The story begins with a career that seemed, from the outside, almost impossible to predict in its scale. A dermatology practice in Southern California slowly evolved into something far larger than medicine alone. It became a global media presence, a recognizable identity, and a cultural phenomenon built around one doctor's unusual ability to turn deeply personal skin problems into moments of transformation. Millions of viewers came to know Dr. Sandra Lee, not just as a physician, but as a calming, steady presence who addressed conditions many people felt too embarrassed to even discuss. Patients arrived from across the country carrying not only physical concerns but emotional weight, insecurity, shame, anxiety, and long-held discomfort in their own skin. She treated them all with precision and empathy, while cameras documented the process for a growing online audience. What started as a small clinic eventually expanded into television, skincare branding, and an international following. Yet beneath the success, the pace of constant work, filming, and medical responsibility quietly accumulated pressure. There was little room for pause. Every day demanded focus, consistency, and emotional control. It was within this high-functioning environment, one built on healing others, that something unexpected began to unfold, unnoticed at first even by the person it was happening to. A normal day that didn't stay normal. On what appeared to be an ordinary filming day at her clinic in Upland, everything followed its usual rhythm. The lights were set, the cameras were rolling, and patients were preparing for procedures that often carried deep personal meaning. Dr. Sandra Lee moved through her schedule with the same composed efficiency that had defined her career. She consulted, examined, and performed procedures with practiced precision. Nothing about the environment suggested disruption. Yet internally, subtle changes began to surface. A sudden wave of heat passed through her body, unexpected and difficult to contextualize. Her thoughts felt slightly clouded, as if attention required more effort than usual. She dismissed the sensations as temporary, possibly fatigue or a minor physiological reaction. In a high-pressure medical setting, it was easy to rationalize discomfort and continue working. She completed her responsibilities, maintaining professionalism in front of patients and crew. At the time, there was no clear indication that anything serious was developing. The human mind is often trained to normalize small irregularities, especially in demanding environments where stopping feels like failure. So she continued forward, assuming the symptoms would pass. But they did not fully resolve. Instead, they followed her quietly into the hours after filming, where the situation began to shift in a way that could no longer be ignored. When subtle symptoms become impossible to ignore. Later that day, at her parents' home nearby, the discomfort did not fade as expected. Instead, new symptoms began to appear, more difficult to dismiss. Her body felt unstable in ways that were hard to describe, small but alarming disruptions in coordination and sensation. A sharp, shooting pain traveled through her leg without warning, interrupting normal movement. She attempted to rest, to regain a sense of normalcy, but something fundamental felt off. The connection between intention and physical response seemed slightly delayed, as if her body were no longer responding with its usual precision. That night, sleep did not come easily. Anxiety grew quietly in the background, though she tried to rationalize it as stress or exhaustion. By morning, the situation had escalated. Movement became uncertain. Balance felt compromised. Then came a moment that shifted everything. Her left hand no longer responded properly. It weakened, collapsing in a way that felt foreign and frightening. Soon after, speech became affected, words emerging with slurring and confusion. At that point, denial was no longer possible. The thought surfaced clearly. Something neurological was happening. Even with medical knowledge, recognizing the severity of one's own symptoms is not always immediate. Yet the signs were aligning in a way that suggested urgent danger, and the reality could no longer be postponed or explained away. The moment of realization and the race for help. What makes this situation particularly striking is not just the symptoms themselves, but the hesitation that followed them. As a physician, Dr. Sandra Lee was fully aware of what these signs could indicate: facial weakness, loss of coordination, speech disturbance, and unilateral limb weakness. These are classic indicators associated with a stroke, yet even with that knowledge, there is often a psychological delay between recognition and acceptance. The mind searches for alternative explanations: fatigue, stress, hormonal changes, temporary nerve issues, anything that might feel less severe. This hesitation is surprisingly common, even among trained medical professionals. Fortunately, she was not alone in that moment. Her father, also a doctor, observed her condition without hesitation or ambiguity. He recognized the urgency immediately and insisted she go to the emergency room. That intervention proved critical. In situations involving possible stroke, time determines outcome. Every minute without treatment increases the risk of permanent damage, as brain cells lose oxygen rapidly. The decision to seek immediate care transformed what could have been a delayed response into a life-saving intervention. It was a moment where external clarity overcame internal doubt, and that shift made all the difference in what followed next. The diagnosis that changed everything. At the hospital, medical imaging confirmed the worst concern: an ischemic stroke. A blood clot had obstructed blood flow to a region of the brain, depriving it of oxygen and causing tissue damage. Unlike temporary conditions, stroke-related injury is often irreversible once it progresses beyond a certain point. The urgency of treatment lies in minimizing further damage rather than reversing what has already occurred. For Dr. Sandra Lee, the confirmation carried a deeply personal weight. She understood precisely what it meant from a clinical perspective, but experiencing it firsthand introduced a different level of reality. She later described it in stark terms, acknowledging that part of her brain had died. That statement reflects not only medical fact but emotional impact. The brain governs movement, speech, coordination, and cognitive processing. Damage to any area can affect essential abilities that define both personal identity and professional function. In her case, the implications were especially significant. Her work depended on steady hands, precise motor control, and clear communication. The diagnosis was not just about immediate health, it raised questions about her future capacity to continue the career she had built over decades. The gravity of that moment extended far beyond the hospital room. When identity and profession are suddenly at risk, the consequences of a stroke extend beyond physical health. They reach into identity, independence, and livelihood. For someone whose life's work depends on precision and control, the implications were particularly intense. Dr. Sandra Lee's career as a dermatologist required steady hands for delicate procedures, clear communication with patients, and sustained focus during long hours of clinical work and filming. With neurological function compromised, each of these abilities came into question. There is a unique psychological challenge in confronting the possibility that skills developed over a lifetime may no longer function in the same way. It is not only about recovery but about uncertainty. The fear was not just whether she would survive, but whether she would be able to return to the profession that defined her purpose. This type of disruption forces a reevaluation of identity itself. When physical capability is intertwined with professional identity, any impairment feels deeply personal. At the same time, the external world continued moving. Productions paused, schedules halted, and a public-facing empire temporarily went silent. Yet internally, the most significant struggle was not the pause in work, but the question of what would remain possible afterward. That uncertainty became the next phase of her journey, the roots that shaped her path. To understand the weight of what she faced, it is important to look at where her journey began. Her father worked in a rural clinic in Malaysia, often improvising with limited resources while trying to diagnose and treat skin conditions. He relied on a single medical reference book, using it as a guide in environments where modern tools were scarce. That early experience shaped a mindset of persistence, curiosity, and adaptability. Eventually, he brought that dedication to the United States, where his career expanded and laid the foundation for his family's medical legacy. Dr. Sandra Lee grew up observing this commitment firsthand. Medicine was not just a profession in her household, it was a way of thinking and solving problems. However, Her path into dermatology was not immediate or guaranteed. She did not initially match into the specialty she aspired to enter. Rejection forced her into uncertainty, requiring her to reassess her direction. For a time, she considered alternative paths, but ultimately chose to persist. She reapplied, trained, and eventually entered dermatology, later taking over aspects of her father's practice. This foundation of resilience became central to everything that followed, even if she could not have anticipated how important it would become later in life. Rejection, persistence, and the making of a specialist. The journey into dermatology was not a straight line, but a series of obstacles that required persistence. Early rejection from her desired specialty could have ended the path entirely, as it does for many aspiring physicians. Medical training is highly competitive, and setbacks often force individuals to change direction permanently. Yet she chose to continue pursuing the field. This decision required both emotional endurance and practical flexibility, as she navigated alternative training routes and continued building her expertise. Over time, she refined her skills and re-entered dermatology training, eventually establishing herself within the specialty. Her work combined clinical precision with an ability to communicate clearly with patients about conditions that are often sensitive or stigmatized. That combination later became central to her public identity. Taking over her father's practice added another layer of responsibility, linking generational medical work with modern practice. What began as a struggle against rejection eventually became the foundation for a career defined by resilience and adaptability. This background is important because it illustrates that persistence was not new to her. It had already been tested long before fame or public recognition entered the picture. From clinical practice to global attention recovery, reflection, and a changed perspective. Following the stroke, recovery required time, patience, and significant adjustment. For approximately 2 months, she stepped away from operating, filming, and many aspects of professional life. Basic functions that had once been automatic, walking steadily, maintaining balance, speaking with clarity, required conscious effort. The left hand, central to her surgical work, did not immediately return to its prior level of function, creating uncertainty about long-term capability. Rehabilitation is often unpredictable, with progress occurring gradually and inconsistently. Alongside physical recovery came psychological adjustment. Returning to the environment where she previously worked brought emotional complexity, as familiar spaces now carried reminders of vulnerability. Eventually, she made the decision to return to work. Though the experience was different, there was a heightened awareness of physical limits and a deeper recognition of how quickly health can change. Rather than hiding the experience, she later chose to speak openly about it. This decision was not driven by attention but by awareness of how easily warning signs can be dismissed. By sharing her experience, she highlighted the importance of recognizing stroke symptoms early and seeking immediate care. Today, while she has returned to professional activity, her perspective has shifted. The experience left a lasting imprint, not only on her health, but on how she understands time, work, and the fragility of physical ability.